Welcome to another episode of Dr. Kamini Rao's Masterclass, this time in the Pearl City of India. You guessed it right, yes, Hyderabad, widely known for its Persian brand of tea and one of the largest film cities, Ramoji Film City. The metropolis also has one of the biggest gastroenterology hospitals in the world. Well, yes, we are here today at the Asian Institute of Gastroenterology, India's foremost gastroenterology hospital, and I'm completely enjoying the hospitality and the serene environment here. By doing what you love, you inspire and awaken the hearts of others. The saying goes very well with our special guest today. He belongs to the third generation of doctors in his family. Yes, you guessed it right, his grandfather, his father, and now him. Why would I say a third generation? Because when you talk of a generation, the ideas change, the philosophy changes. The grandfather passes on some kind of philosophy to the father, and then the father passes it on to the son. We have certain philosophies, may not be agreeable to the son, but when it is said and the son follows, an institution is born. At a very early age, he knew that he would join the medical profession because he was in that profession. His unique insights and visionary skills will inspire you to look at even familiar things in new ways. Undoubtedly, he is a mentor to the nation's young generation. Let's not keep you waiting anymore. It's my privilege to introduce Padma Shri and Padma Bhushan, Dr. Nageshwara Reddy. I feel elated to introduce him to you all. Welcome to the show, Dr. Nageshwara Reddy. I am extremely delighted. I must tell you, when I came down from the airport, there was so much of nostalgic moments that I would come into that old building, crowded building with compassion and passion over there, the kind of hope that people have in their eyes just to see Dr. Reddy, Dr. Nageshwara Reddy, or Nagi to your friends, and they're so close to Tirupati Devasthanam. It's almost coming in and waiting at the doors of the Tirupati Devasthanam to see you. And I felt that, look, that is the hope that I want people, because they always say that disease is 50% psychological and 50% physical, and you actually are an epitome for that. And I felt that when I came again here, I said, now I'm going to see the Dr. Nageshwara Reddy. And I was totally surprised to see this big institution. So going back into your career right now, when was this institution actually born? When did you get into this kind of a place?
Yeah. So this place actually, this land of about 10 acres was allotted to us by our previous Chief Minister, Mr. Rajshekhar Reddy. He actually came one day to our old institution and then saw the big crowd there and said, this is too much crowded, why are you still here? You must build something very big, the best in the world. So he said, we have this 10 acres of land from the government and we want to develop a health city in that. I said, 10 acres you can't do a health city, but you can do a big institution there. And that's how 2008 he allotted this to us. But following that, there was a series of problems in the state in terms of agitations and so on. So it was actually 2014 we started. There was a huge hillock here, so we had to break the rocks. It took us 2 or 3 years to actually finish all that. And the actual building came up by 2016 and it was completed by about 2017, 19, completed.
Yeah, but Dr. Reddy, you're an extremely good practitioner. You've been called across to all the sort of big conferences across the seas, east, west, north, south, and a fantastic practitioner and healing hands, warm heart. Why did you get into kind of institutional kind of practice when you knew that there was a lot of money coming? Most of the present day generations are all looking at how much money can I make, and yet you decided to change that mindset and say, what made you change that mindset?
So it was actually, I came back from PGI where I did my DM in gastroenterology in 1984, and I started practice in Hyderabad. Of course, like everybody who struggles with the initial days of practice, we struggle, but slowly build up a huge practice. By 1990s, I had a really big practice in gastroenterology, and we introduced a lot of endoscopy techniques. So that was again one of the factors why a lot of patients were coming to us to see us. So we had this huge practice, and I was working maybe 20 hours a day, making a lot of money. Because I came from a very, I think, moderate family, or what you
Middle
say,
class family.
middle class, or even lower in terms of monetary. My dad was a professor of pathology, my grandparents were professor of pathology, but none of them they were just on the government salaries, which was like 200 rupees or something at that time. So we couldn't afford so much. So I came from a very humble beginning. So when we have practiced, so much of money coming in, it was a different type of thing, I sort of thought this was the ultimate thing, this is what I'm supposed to do. As I was going on in this, one day my dad called me for lunch, and I was staying in a separate house, so he said, you come for lunch, and then he the first thing he said when we sat down for lunch was, I'm very disappointed with you.
That must have surprised you.
It surprised me, because I was not a good student in school. I had gone into medicine, then I did my gastroenterology, then I came back and I started this practice, and that time there were only 4 or 5 gastroenterologists in Andhra Pradesh state. So I was doing very well. So I thought I thought I was doing well. I thought he should have thought I was doing well. But when he told me he's very disappointed, I'm going to go disappointed, I said, why, what's the reason? He said, what have you done in terms of what have you done to the society? What have you done in terms of academics and research? Have you published anything? Have you taught any students? Have you brought up students? Have you built any institution? None of this. And just practice and making money for yourself is not being successful. Success means something different. And I realized that his concept of success was totally different from mine, and at that moment I changed. I think that was a single moment which made me realize that I think you can make money. I mean, a lot of people make money, but there's a limit beyond which doesn't mean anything. That what you give back to society is more important than what you do in terms of making things for yourself.
I think that's the mantra, Dr. Reddy. I think, giving back to society, and even while giving back to society, you can make money. The same rupee, instead, if you say that you want to give 1 lakh of rupees to one person, if you split that 1 lakh into 1 lakh pieces and say 1 rupee per person, and you are able to take and make those lakh people happy, because usually the large numbers will be able to subsidize so many things. It makes a lot of difference. And I think, the joy of giving and the joy of caring is something much beyond your earning that money, because you can only eat 2 meals a day, and you eat much more, we'll have to come to your department again. So I think either I'll have to come into your, what do you call this, obesity clinics, or I'll have to come in with some jaundice or something else. So I think there is something which your father said, because I think even in olden days, his salary was about 200 per month, and yet he was so happy. Yes. So happiness is a state of the mind, and it's not about how much money we can make. And after all, at the end of the day, when you have 1 crore, 2 crores, 3 crores, I mean, beyond that, what do you take when you die? And at the end of it, if you want to go, you have to leave a legacy behind. And people with your kind of knowledge and skills, don't you think you have to get a generation of people to be able to follow what you did? So that, medical colleges should come up. People with your kind of vision should be able to sort of carry on your good work. And I think what your father said was very right. And look at what has happened, such a big institution.
I think he's right, because then we started publishing. We now have nearly 1,000 papers in big journals, Nature, New England Journal, Lancet, and so on. We have a good team which is high impact journals. We've been able to do that, and very cutting edge research that we had a team that came in together. But what was again very striking was, after he said that, we started thinking of this concept, but still didn't have that kind of money for an institution. We found that we're surprised that there's so much of donors coming in, so much of donations. Even now, we get these huge donors who come in and say, okay, you build the auditorium in this, I'll give you the whole donation for this, things like that. So we are very surprised that if you look at people in general, I think our society still is very generous. They support causes which they think is good for society, and that is something I found very striking, which is not realized. People think that only in US there's donations for universities and all that, but even in India also there are a lot of people who have that tendency, and we found that a lot of things could be just built on this. So at that point of time, we all of us stopped practice. We went on to salaries, and then we gathered this team. And one of the good things that happened for me was that we started getting excellent team. In fact, most of the credit subsequently to what we did should go to the team. Of course, as a leader, I bask in their glory, but it's the team which we had some excellent people. Each of them became a world leader in each area. Small intestine, one leader; pancreas, one leader. So all of them started coming together, and this team was the one which actually brought us to this level.
Agreed. But then do you feel at the end of it that yes, the Dr. Nagi Reddy and I cannot achieve to be what he is? But if I just jog your memory back, as a student, as a youngster, perhaps in the 3rd standard, you actually failed.
Yes.
Yes?
Yes.
Can anyone believe, my viewers, that Dr. Nagi Reddy failed in the 3rd standard? So how many of you who have failed in the 3rd standard can really be a Dr. Nagi Reddy? Well, here you are, an example. So how did you feel when you failed?
Yeah, so at that time, of course, we didn't realize what passing in failure or first rank in school was. I somehow didn't fit into that school. It was ways to make all of us sit down, teach there and things like that. Somehow I didn't fit into that, so I didn't do well. I failed, and at the same time I was also, 3 of us, we are 3 brothers, and we were very naughty. We did things which upset our parents, like very abnormal things. And in fact, one evening I put my youngest brother, 1-year-old, in the fridge because very hot. We were in Visakhapatnam, heat it was. I just put him in the fridge saying, okay, he'll get cool there, and then close the door. And after an hour, when my mother opened the door, he was cyanotic blue and all that, So it was coming to that extent. So my parents, and once we burned down the garage to see how petrol works. So my parents were very upset.
You have been antisocial. So
I was actually
out of
very
curiosity.
Yeah,
so that's an inquisitive mind.
It was inquisitive, but that time it was not realized. Child psychologists didn't come in there. Now they say if you are naughty, it's good. But that time it was thought to be very bad because my father was a senior. I mean, he was only 30, but he had already become a professor. I came from a family of people who were very different in thinking. My grandfather, my mother's father, was a professor of pathology and medicine, both medicine and professor at Madras Medical College. He was a close friend of Alexander Fleming, who discovered penicillin. Penicillin. In fact, Fleming used to come and stay with him, and they're close friends. He's published some very, very early work on cancer, etiopathogenesis, which was being quoted everywhere. From my father's side, grandfather Jagannath Reddy was also a very famous pathologist who built Jipmer. He was the one who was the director of Pondicherry.
Yes.
He built the whole institute. Again, very famous pathologist, and several papers he had which were published in major journals. And my father was the youngest professor of pathology in the country at that time. He came back from Washington Institute of Pathology, Armed Force Institute, very prestigious, became pathologist. So they're all these intellectuals, and then they suddenly find this grandson who has not passed school. So all these 3, all of them were of course bald, all of them got together one evening, sat down and said, this chap is not going to be of any good. He's going to spoil the whole family prestige, because their prestige then was to do well in your studies and all. So they said, I think at least let's hope he becomes a good auto mechanic. So build a small auto shop for him so that he can do repair, because I was good at repairing things and all. Repair scooters, cycles and all, we'll do that. And that was their aim for me. And because of all this problem, they said, let's send him off to a hostel. So at the age of 6 years, I was sent off to a hostel, Hyderabad Public School here. And then I was in the hostel for the rest of my life, everywhere, wherever I went. The first few years in the hostel also I was same. I was quite naughty, not doing well and all. And at 9th class, we are 4-5 of us friends sitting there, and then one of the leader, we used to have a class leader at that time, pointed at different fellows, said this chap is good in sports, this chap is good in studies, and when he came to me he said this chap is not good in anything.
So
that changed my...
A person who is failed in 3rd standard, who then goes across and puts his brother in the fridge to make him cold, and then he's gone and actually burnt up a garage to see how petrol works. See, this is the inquisitive mind, and your father at that early age realized that you were very good at repairing things. And that's what you did with your biliary surgery and your dressing. So you were able to repair things. So that's where I think the seeds of repairing actually started. So what you may have thought as naughty actually started there. Apart from that, you getting into a hostel, you didn't stop your naughtiness, which means your inquisitiveness. You still went on, and only when you were told that you were useless, that is what it really struck, and you decided to study hard. Isn't that important?
I think, so I now realize that when you actually, now when we have so many students, we have trained at least about 400 students in DNB courses, thousands of students in various endoscope procedures. I'm still frightened whether to call, somebody is not doing well, to call him and say you're useless, because for me it worked, it sort of changed me. But whether how it will affect the person, we don't know. Whether it will have an opposite effect, get somebody into depression or say that he's not good. So it's still, I think, difficult thing to come. But at that point for me, when somebody said you're useless, that changed me. That determination came that I should change. I should. Now what will I excel in sports? At that point I was a little short and not very sporty type of person. So I knew that I wouldn't do well in that. So the only thing was studies. If I worked hard, I realized that I could. So when I worked very hard next 2 years. We had that metric system at that 10th class.
Okay.
So 10th class, and so the results used to come in papers after that. In the 10th class results, what happened is whoever comes first in the university's name comes first. The rest of the people, the numbers come. That's how it used to be, and everybody used to. So my exam was over, I went home, and then the results came in the paper, that was the Deccan Chronicle. I remember my daddy took out my number, he started. He never knew that how I transformed. So he looked at the numbers and said, finally looked at all through, not in the first class, not in the second class, not in the third class. So he thought he failed, and expected that, as expected. Even for him, failing 10th class was not good, but he expected that. But what he didn't see was right on the top, my name was there. So I was the university first ranker at that time. And of course that
changed his mindset, and then he started respecting you.
Then of course I went into intermediate at that time, and then we had exams for Medical College, Kamini Medical College. So I did my MBBS in Kurnool Medical College. Very nice atmosphere. It was small. It's a rural type of college. Even the professors used to come in cycles. Wow. Yeah, it was very different. And after when I was doing house surgery in the evenings, I would not waste my time like others, but I would go to the research lab. We had an anatomy professor, Dr. Saumitri, who should do a lot of research, genetic research at that time. So I used to go and spend my evenings in the lab there, and we started publishing then early itself. So my interest then came into medicine. Then I did my. That time there was a big strike in Andhra Pradesh. So all the students lost 1 year. I didn't want to, so I went to MMC Madras Medical and did my medicine under Professor K.V. Thiruvengadam, very famous professor. Very famous. So it was under him, and then that was also very inspiring.
Excellent, because when you really want to do something, and if the river is in flood, it's always said that if you put a dam there and that determination to read is so strong, it'll just break and form a new path and then go away. And that's exactly what you did, and you've come up that way. So a boy who failed in the 3rd standard, who was very mischievous and who was able to come right to the top, is a perfect example to say, why be ordinary when you can be extraordinary? That extraordinary is within you. So even if you fail, failure is not final. Failure is a stepping stone to success, and this is what you have proved in yourself. And looking back now, at that point of time, you said to yourself that this is what I'm going to do, and I'm going to go forward. And when did you think that you would do liver and
gastroenterology? So gastroenterology, I was very interested because when I was doing medicine in Madras Medical College, there was a person called Bloomberg. Bloomberg was the one who discovered hepatitis B virus. He came as a visitor there, and he was also very close to my dad. So I used to see them talking. They had some meetings and dinners and also. So I got very fascinated with hepatitis B virus at that time. So then I said I should do liver and gastroenterology. So then that time there was only one seat in whole of the country in Chandigarh, PJ Chandigarh, for DM Gastro. It was a specialty. So cardiology, neurology, everything was recognized, but not gastro. Just started specialty. So I said I must do this to work with hepatitis B. So I wrote this entrance in PGI, got in the seat there in PGI. Then started working in gastroenterology. When I was working in gastroenterology, I was initially started a lot of. In fact, I published my first paper in Lancet as a student in gastro there. In between, we had a professor who was very good with endoscopy, Dr. Jung Dilawari. So somehow he influenced me, and I realized my hand-eye coordination was very good. So I sort of shifted from hepatitis B research into endoscopy, because I realized I could do more things endoscopically than in liver. So there's a liver professor there, Professor Sheila Sherlock, who was very famous,
Yes,
Dame
I
Sheila
know.
Sherlock.
Dame.
So she came as a visiting professor, Dame Sheila Sherlock, and she was a very tough professor. So after she was spent a few weeks there in PG, and when she was going off, she told me, after you finish this, you're coming to me, you're working with me, you're going to co-edit my book and all that. She made the whole plan without even asking me anything. So to come to UK, and then she had a big practice, used to see all those shakes and all that at that time. So, but I got interested in endoscopy, and I was actually frightened to tell her that I'm more into gastrointestinal endoscopy than into doing liver research. So finally I had to tell her, and then she was very upset, she was very angry with me. She was so angry that she was a very powerful lady, Dame Sheila Sherlock. You can't talk to her, she was like the queen. And
She was the last word.
Yeah, last word. So a few years afterwards, I'd been invited to do a big workshop in Europe, in London, and there was this big, very difficult ERCP CBD stone I had to remove. So I removed all that and then cleared everything, and there was a big applause from the audience. I walk out into the corridor, and she's standing there in the hospital. She was the chief professor. She looked up and down and said, "You have become a technician now." She was not happy with. She felt that as doctors, you must only be doing research and not. But later on, she realized that this also was a very important field. It was just developing. Gastrointestinal endoscopy just came in. The first few, so that I think one of the things that we could get to this level was because we caught a specialty was very early. Like you're into infertility, probably one of the first persons in the country into infertility, and then you could spread this whole thing. That's how it happened with endoscopy for us. We started very early.
First movers in the subject.
First movers.
You are known to be an extremely kind person, and that's perceived as weakness. And I don't think that being kind is being weak, and weakness is not something which is negative. I feel that you can actually get a lot more by being kind, and weakness is a strength. How would you prove that by example?
I'm still told that in administration you have to be tough, you can't be kind to people, and you have to. So I find it very difficult. Even now I find it very difficult to fire an employee who is not good. Because I always think you should give another chance. But sometimes I'm told that you're doing it wrong, this is not the way. If you want to run an efficient organization, you have to be tough. You have to sometimes. So I find it difficult, that's my nature. But I've been fortunate that this hasn't affected me, because overall I think we have a team which has been appreciative of what we have a team which has been, where emphasis is on being kind and humane to people rather than being tough and being taskmasters. We got along. I think there's a difference of opinion on how administration should be run. My opinion is that I think everybody should get a second chance. That there are of course some bad people, really bad people who have to be tackled, but even then that has to be done in a manner which is appropriate, not. So this is whatever we call it, weakness or whatever it is.
I think it is more in terms of understanding the situation as to why are they not performing.
Yes.
Many times, they are put, it's like a round pin in a square hole, and they've not understood the job.
Exactly right, yeah.
One, or the job has not been explained to them by their immediate seniors. And thirdly, of course, there must be some kind of family problems at home as well, which has not been addressed.
Exactly.
So if we don't address the root problem, this thing is going to...
No, I understand. I think there's, so you find that sometimes somebody has done a mistake, and then you call him, and then you're very tough with saying you are harsh, and then you realize that his child has having fever for last few due days, he's tired and not. So I think it's very important, like absolutely what you said is right, that we should get into what happened.
And then sort the problem out.
The only thing I don't tolerate, even in our institute, is arrogance from people.
Yes.
Now, that is something, arrogance is something which, I think in medicine especially, I think humility is very important. That people come to us with a lot of problems, so much, and they are giving themselves to us. And it's, in our part, we should be extremely understanding. Empathy is, I think, a very important aspect, which that is something that gets me very upset if somebody is not empathetic to the patient or is arrogant to the patient.
Don't you think all this empathy and patient bedside manners and all that is what rubbed off onto you with your, learning abroad? Because we really don't have the time to learn over here. So counselling is such a big thing that I would thank all my people in the UK. For it, because we don't have a separate course in counselling, and we have a patient-centric approach rather than an organ-centric approach, and perhaps most of your counselling skills have come through that.
Yeah, because if you look in UK, if you look at whoever is trained in UK, you realize that the type of counselling, the patient-centric phenomena is totally different. with what is happening here. Unfortunately, we are told that you are very good clinical, Indians are very good because they're seeing large number of patients. I don't think that's I mean, we can be good clinically, but I think what is more important is the holistic approach to the patient. The patient comes with a problem, have we solved it or not? You can make a rare diagnosis and say that this patient has some mitral stenosis or something and all, but if you have not solved the patient problem, both in terms of how the patient perceives it, that he's not comfortable and so on, then I think there's no point in medicine. I think medicine is treating the patient, not treating the disease. To me, that's very important.
Absolutely. More, it's treating the mind.
Treating the mind and the patient as a whole, the patient's family, rather than just
Absolutely.
getting at the disease. So that is something I realized over a period of time. We used to, I'm actually supposed to be an expert in ERCP, getting stones out of the bile duct and all. And one of my professors in UK, Peter Cotton, told me at one stage when I was actually that, look, Nagi, it's not important to look at a hole in the patient, but the patient as a whole.
Yeah, that's a
Just looking at a hole, you can remove stones like laparoscopic surgery, you can do things, just looking at, but more important to look at it as a whole. I think this is very important.
extremely important statement, and he's written a book as well.
Yes, he's written a book.
A very, very important person. But having again gone back to this thing, as a doctor, a young doctor, you had this thing of wanting to make a lot of money because you felt that being in that middle class group or the lower middle class, that I never want to feel that want that whatever I want to get, or my family should never have that want. I'll bring them and make them feel happy. And then suddenly you went into philanthropy because you went to make an institution. You took a salary and you went and visited the same places, and then you started doing philanthropy. How was the feeling? On the one side you did practice.
Yeah, no, feeling I think was in fact totally different. In fact, the satisfaction you get out of doing philanthropy or trying to serve people and look after them is totally, I think this set of satisfaction you never get in any other way. I mean, as doctors, sometimes being successful doctors, we start getting awards and this and that recognitions. But the recognition you get from a patient who's, you have done something for a patient, without the patient having to pay something, not expecting anything, that type of feeling or satisfaction is phenomenal. I don't think we can get it. I think as doctors we are blessed that we can get this compared to any other profession. So that is something which has been very rewarding. One of the things that helped, of course, was my family. Fortunately, my wife understood what was happening. I've been telling her from the beginning that I'm wedded to, partly to her, but partly also to gastroenterology and doing things to people, and she understood it. My daughter also is very understanding. Otherwise, if you don't have an understanding family, then you get into a big problem. Because they're in conflict. When they say, okay, you're making so much money, why do you want to suddenly change, and now our lifestyle changes everything. So, but I think they've understood.
No, but the fact is that how much does it take to make you happy is something that you have to look at. And how much does it take? Like, for example, a person can survive with, say, 10,000 rupees a month, and a person can survive with, say, 1 lakh a month, or somebody can survive with 5 lakhs a month. Now, the question is, you have to cut your coat according to your cloth.
Yes, exactly.
But at the end of it, what is happiness at the end of it? Are you happy at the end of 5 lakhs or 1 lakh or 10,000?
This is a question actually.
This is a question you have to ask yourself.
Yeah, question you ask yourself. And this is a question that I've asked. As I said, we had an opportunity to many top industrialists, some of the top chaps in the country, and I've asked this question to them. Okay, you are now worth some 5,000 crores, but why do you want to go more? Why don't you say, I'm going to donate this 4,900 crores and keep 100? 100 crores is very much this thing. Why? What is your level of? Nobody is able to answer this question. I think what happens is a sense of addiction comes in after you get to a certain level. It's not that they want that money or they have a need for that. Even if you have your own private plane or you have anything, even then you can't spend 5,000 crores. But it's a sense of addiction, I think, that comes in.
It's almost like gambling.
Gambling, yeah.
Yes.
And you get attached to that, and then you find that many of them leave things to their children, who then waste the money and they're not properly. So I think this is a philosophy, again, Indian philosophy, which we have to sort of change, that whatever you have, you give comfortable. I'm not saying that one should starve or live in a hut or something. You go to your comfort level, find out what's your comfort level. The rest of the things is just wasted. The rest of the things should go back to society. Then you can create something which
more valuable.
And I think create something which is lasting.